Trinidad and Tobago is pursuing two methods to secure COVID-19 vaccines for the population by March 2021. Health Minister Terrence Deyalsingh at the first Ministry of Health press conference for 2021 outlined the two areas that government is pursuing to secure vaccines. We have more from Terry-Ann Browne Campbell.
Health Minister Terrence Deyalsingh, speaking at the San Fernando Teaching Hospital, indicated that the World Health Organization's vaccines for this part of the world is the COVAX trials. He outlined the process that government was taking to ensure that this country would have access to approved vaccines.
Trinidad and Tobago is pursuing the procurement of vaccines via two mechanisms. One, COVAX, and two, out of COVAX. We are pursuing talks with Pfizer, AstraZeneca, and the government of the People's Republic of China.
The minister indicated that while some of the population was eager for this country to get our vaccines as quickly as possible, he noted that this was not the safest course of action.
By March, the world community, which is currently vaccinating people by the hundreds of thousands, it means we will have a lot more what is called endpoint data. We will have a lot more safety data. We will have a lot more efficacy data. We will have a lot more data on the use of vaccines in what we call special populations or complex populations.
The minister also noted that this country was one of the safest places to be if you are concerned about contracting the virus.
The case fatality ratio is the number of persons who have died divided by the number of positive tests, individual positive tests you have in a country. That's how you calculate your case fatality ratio. The global average of case fatality ratio is in the region of 3%. Trinidad and Tobago's case fatality ratio is 1.77. This
country stands with New Zealand and Vietnam as having one of the lowest global averages of COVID-19 deaths. Terry-Ann Browne Campbell, TTT News.
And on the topic of COVID-19 deaths, the number of COVID deaths holds steady on the first day of the new year at 127. Meanwhile, 8 new positive cases have been reported. The total number of active positive cases continues to decline, going down today to 360. 25 people are currently in hospital.